Good morning to Madam Wan and all my friends. We are from Group 7. We are talking about behavior theory and cognitive theory. So first of all, I'm gonna introduce my member group, which is Usna Khadija, Sai Christina, Priscilla Hema, Monita, and Nino Isahani. So for the introduction of behavior theory has a psychological approach that combines elements of theory, philosophy, and methodology. And also, behavior theory has a several variation that means like information processing theory, emphasis on learning, skill giving to authorities. These theories are behavior imaged in the early 20th century as a reaction to psychologists who often have trouble making prediction tests using rigorous experimentation. This is a very influenced psychological in 20th century and 1920th century and 1930th century was a John Watson, and for 1950th century and 1960th century was a B.F. Skinner. This behavior theory was the only behavior that needed to be studied in terms of the behavior that were noticed directly. Behavior that, therefore, this is the action, not a thought or an emotion. This theory of behavior does not explain abnormal behavior in terms of the way it works or to brain. In fact, this theory of behavior suggests that behavior is something like frequently studied and seek to explain how such habits are formed. So for introduction for cognitive theory is involved from other perspective theories such as behavior and psychodynamic, which is linked internal thought process with human behavior. This cognitive theory will also explain how humans behave by understanding their thought processes. Like example, according to Jean Piaget study, they study the intellectual plight of 3 children since infancy, beginning at mid-20th century.
Hello everyone, my name is Priscilla. So I'll be presenting about the background of theories. Next slide, please. Uh, the first theory, will be behavioral theory. So John B. Watson, also known as Watson, was a leading proponent of changing psychology's focus from the mind to behavior. And this strategy of watching and influencing behavior became known as behaviorism. Moving on, because of its objective methodologies and in particular experimentation, behaviorism is largely responsible for establishing psychology as a scientific study. Furthermore, it's also utilized in cognitive behavioral and behavioral treatment. In the classroom, behavior modification is often utilized. B.F. Skinner, also known as Skinner, like Watson, was a behaviorist who focused on how behavior was influenced by its consequences. As a result, Skinner emphasized the importance of reward and punishment in driving behavior. Skinner created a chamber as part of his research to enable for the meticulous investigation of the concepts of behavior modification through reward and punishment. This instrument, known as an operant conditioning chamber, or more commonly a Skinner box, has remained a valuable tool for behavioral researchers. Besides that, the notion behind behaviorism is that it is possible to measure, train, and even modify one's behavior. It claims that our behaviors are shaped by individuals' responses to environmental stimuli. Next, to put it another way, rigorous behaviorists think that all behaviors are the outcome of previous experiences. Given the correct conditioning, everyone, regardless of their history, can be trained to act in a specific manner. Finally, behaviorism became the major mode of thought in psychology by around 1920 to the mid of 1950s. Next slide, please. So the next one will be a background of cognitive behavioral theory. So Jean William Fritz Piaget, also known as Jean Piaget, was indeed a Swiss psychologist who pioneered cognitive developmental theory. Moreover, in the fields of developmental psychology and the study of human intelligence, he was a significant experimenter and thinker. Moving on, Piaget was the father of 3 children, 2 daughters and a son. He spent his time with his children while also keeping track of their development. He was able to comprehend the stages of kid growth as a result of this. With the support of his wife and children, he was able to learn about these developmental stages in the most direct way possible rather than through a theoretical study. Instead, he was able to observe the many stages of growth in a very practical approach. As a result, he studied children of various ages and developed the phases of cognitive development, which became the foundation for distinguishing educational systems based on the stages of development of children. In the other hand, Alfred Adler, an Austrian psychotherapist, was one of the first therapists to treat cognition in psychotherapy in the early 19th. His concept of basic mistakes and their involvement in unpleasant emotions made him one of the earliest therapists to discuss cognition in psychotherapy. In the 1950s, his work influenced American psychologist Albert Ellis, who developed rational emotive behavior therapy, also known as REBT. Moving on. It is founded on the premise that a person's emotional pain is caused by their perception of an event instead of the event itself. During his analytical sessions in the 1950s and 1960s, American psychiatrist Aaron T. Beck found that his clients had inner conversations going on in their heads. He noticed that the clients seemed to be conversing to themselves, but they sometimes shared a small portion of their thoughts with him. Finally, conditioning ideas was developed by B.F. Skinner, influenced by the development of cognitive behavioral therapy. I'll pass it to Izana.
Key concept of behavior theory. From the perspective of human, key concept of behavior theory is a commandate of a systematic and structured approach to counseling. This view does not rely on deterministic assumption to human beings, but they are only product of adaptation, their social culture, but rather the view also depends on the fact that person is a producer or product of the environment as well. This current trend for this behavior is to explain procedure that give control to the client. Thus, this behavior theory have a level that can improve people's skill so that they have a more option to respond. Humans who are able to overcome behavior that's weak and restrict choice to the person is more free to choose and likely that was previously unavailable to them and increase the person freedom. There are 7 main features of this theory of behavior. First is principle of procedure through a scientific method. This principle of learning study will apply systematically to change in approach human behavior. This is a special feature of this behavior petition in their systematic and the rest to occurrency and empirical evaluation. Behavior therapy will state to the purpose of treatment objectively correctly enable replication of their interpretation. Throughout course of this therapy, the therapy will assess the behavior of the problem and the condition that perpetuated it. And with the method of assessment, the therapy can find out the effectiveness of the treatment procedure. This therapy technique is used to show its effectiveness of the theory. In short, we can see this concept is empirically tested within a conceptual framework and will be reviewed on an ongoing basis. So for the second feature is internal processor. So we can see a behavior includes such a connection, thought, belief, and emotion, as well as avoid behavior that we can see. Behavior most distinction feature is that may be proportionally defined. So for third is current client problem and factor. Behavior theory able to address client problem and the factor involves them compared to analyze a possible historical determinant. This factor affect who will work that what factor can be used in changing problem. From the understanding of the past, we can provide useful information about environmental events related to the present behavior. Behavior therapy will look current environmental event that can sustain behavior with environmental event of process. We call it functional assessment. So this behavior therapy can recognize the importance of the individual, and individual environment can interact between people and the environment in facilitating change. And fourth is play an active role. Clients involved of behavior therapy are expected to play an active role by taking specific action to address their problem. And we can show from this therapy, the client is able to do something about things that can change, bring about changing. Client monitor their behavior during and outside of therapy session, learn and practice coping skills, and play a role in modeling new behavior. The counselor will give a task to perform by the client in daily life, a fundamental part of this approach. Behavior therapy also, this is one of the action-oriented approach to education or learning that sees as a core of a therapy. And client can also learn new and adapt behavior to replace all their approach behavior. And for second main feature is approach. This is assume client change can occur without an understanding and underlying dynamic and without an understanding of origin of psychological problem. Behavior aspect that we given behavior change that can occur occur before or simultaneously in self-understanding. But behavior can improve to self-understanding. And the second last is observation or self-monitoring. Assessment is a process of continuous obsession or self-monitoring to focus, determine of current behavior. This is include identify problem and evaluate change in the assessment informed to the treatment process. Also, in this theory, therapists will assess their client culture as a part of their social environment, including social network related to target behavior, and behavior approach is a very careful assessment of intervention used to determine whether their behavior change or not. And lastly is intervention. This intervention is tailored to their client specific problem. So they are having a variety of treatment to approach can apply to address the issue of a single client. So for key concept of connective theory, this is a fundamental determinant of emotion and behavior. According to this theory also, we can see that brain process is commonly referred to as information processing. The way the human mind works is compared to how computer works by theory. This, according to Jean Piaget, there have four types of key concepts in this theory and cognitive behavior therapy. According to Jean Piaget key concept, first is schema. Schema is a physical or mental action involved in understanding and knowing something. Schema is a category knowledge that can help us interrupt and choose the world. In Piaget's view, this scheme encompasses two categories. First is a knowledge and second is relevant knowledge processing. During this experiment, this new information will be used to change or add to or change to previous scheme. For example, children may have to schema about their type of animals such as dog. The only problem is child experiment was a small, furry, and foliage dog. We can see that suppose that the child is looking for a large dog. This indicates the information has to be entered and changed to previous schema. And second is assimilation. Assimilation of this process is insert new information to previous scheme. This process is somehow subjective because they tend to change experiment or information, something like in line with belief they already have before. For example, like looking at the dog and they are labeling it is a dog. For example, assimilating the animal into dog skin. And thirdly is accommodation. Accommodation is the part where other adaptation avoid transformer and schema modify are based on new information. This accommodation can change exact scheme or idea. As a result, we can see a new information and new experience to their client. This new scheme can change also be developed during this process or addressed to the individual. And lastly is equilibrium. Piaget believed that all children try to achieve their balance between assimilation and change, which is a true Piaget mechanism called equilibrium. As a parent, parents need to maintain a balance between knowledge before assimilation and change behavior to take into account new knowledge of a resident this is a really important. This balance can help to explain how children can move from one level of thinking to another level. So for key concept for cognitive behavior therapy, in short is CBT. CBT is about teaching patients to be therapy for themselves in a way that help them to think or behave more effectively by providing to or changing their cognitive way as well and in approach behavior. There are some key concepts in this CBT can be a group into element to help foster collaborative empirical environment and think that can change that can support a structure focus on CBT. So first key concept of CBT is collaborative collaborative empirism. The information of the collaborative therapeutic relationship between a therapy and the client. They are working together in the team and identify the client connection and behavior problem by test validity and provide feedback if necessary. There's a key information in this collaborative process that can help client identify their problem effective and gain skill to solve them. CBT also is an element that has less specific therapeutic relationship. For example, relationship, understanding, and empathy. To aid this collaborative relationship, the therapy need to explain the rationale for the cognitive behavior model by using example from the client own experience. For second key concept of CBT is emphasis knowledge. So other linguistic treatment, empathic problem or difficult, we call it here or now. This can focus on the cause of the client problem or severing in the past and find way to improve the client state of mind in the present. CBT also involves the setting of information agreed upon by their client. As the goal therapy must be smart, which is a specific, need to be specific, measurable, achievable, realistic, and timeless. CBT session need to be planned to increase treatment effectively in his learning and provide and focus on therapeutic effort from specific problem, their health, potential to cause those problem. This CBT session begin with a setting process for the therapy to assess their client in selecting items that can result a productive therapeutic work in this CBT session. So from this, client can effort in this treatment session and help reinforce of the learning of this CBT concept. And lastly is structure and lasting treatment. For client, this is common, non-common with anxiety or depression. This CBT course will last 5 to 20 sessions. However, this involve personality and intellectual disabilities. In this CBT treatment may take a long time due to the lifelong pattern of the disturbance and longer change will be absorbed in CBT treatment. Connective theory. This is
So I will be talking about the therapeutic process. The therapeutic process is the interaction and the communication between the therapist and the clients that takes place in a therapy sessions. There are 5 stages of therapeutic process, and the first stage is the initial contact, whereby the questions, simple questions, general data, everything will be asked, like payments, schedules, and overview of a problems and so on. So second stage would be orientation, which is building the relationship between the client and therapist. The client and therapist wouldn't be completely comfortable in the beginning, and that is normal because usually in first meeting it's all about making good impression. But as they chat, as they meet often, they will open up more about their expectations, feelings, and thoughts. So in stage 3, it's identification, which is figuring out what to do. So in this stage, the client will be more open, more genuine, and it will be easier for them to talk and also to decide what exactly the client wants to work on. In this stage, it may test the client's boundaries as well as empowering them. So the fourth stage is exploration and working phase, which is making progress. The first 2 stages sets up client for this stage whereby the most progress happens. So the clients will dive more into issues and working on themselves as they dig into their pain as a way of releasing it and moving towards developing a better mindset. So this will basically create a better version of themselves. So in this stage, the therapists will be more upfront and more homework will be assigned to them. The last stage, which is the 5th stage, it's called resolution, whereby the clients will feel accomplished for their changes in them and they might consider leaving. However, some clients do feel like they need a different therapist if they have reached a limit with the current one. So they have options such as stopping or even coming back. So therapy can be a solution to the problem, and client wants to make changes and feel better by working through these issues. Therefore, if that is accomplished, the therapy won't be continued anymore. So this is the time where the client has to reflect on everything that they have accomplished and be proud of themselves. So I will be talking about the behavioral therapy. Behavioral therapy is a method of mental health treatment that is focused and action oriented. Certain behaviors evolve from things that have been learned in the past according to behavioral theory. Some of these activities may have a negative impact on a person or cause a person distress. Behavioral therapy can assist a person in changing their negative behavioral response to more positive ones. So the goal can be accomplished by focusing on either classically conditioned desire response or operant reinforcement patterns. So operant conditioning is used in applied behavior analysis to shape and modify troublesome behavior. So behavioral therapy for substance abuse problems is generally, but not completely, based on methods developed from both operant and classical learning theories. The classical conditioned reaction can be targeted using extinction or counter-conditioning procedures, whereas the operant responses can be targeted via contingency management or coping skills training. So next I will be talking about the CBT therapy, which is cognitive behavioral therapy. CBT is a behavioral therapy that has cognitive component concentrating on the problematic thoughts that underpin behaviors. So play is used in a cognitive behavioral play therapy to diagnose, prevent, or cure psychological, psychosocial issues. The therapist may utilize play to assist a child acquire new ways of thinking and behaving differently. So the next therapy will be dialectical behavioral therapy, DBT, which is a therapy that combines both behavioral and cognitive strategies to help people learn to manage their emotions, to cope with their discomfort, and to improve interpersonal relationships. So people who are afraid of events or items can benefit from exposure therapy, which use behavioral strategies to help them overcome their phobias. So one of the methods includes relaxation techniques that expose people to the source of their concerns. So next therapy will be rational emotive behavior therapy. The goal of this therapy is to recognize and eliminate unpleasant or harmful thoughts and feelings. People then can actively challenge and replace those thoughts with new ones. However, in cognitive therapy, clients' understanding of themselves and their situation is challenged by a cognitive therapy techniques. When detecting cognitive errors or flawed logic caused by atomic thinking, the therapist helps clients become more objective about their thinking and detach themselves from it. So, in a variety of methods, cognitive therapy can aid in the treatment of substance abuse disorders. Cognitive therapy can also be used to change the chain of events when incorrect or ineffective methods of thinking about everyday life events lead to unpleasant emotional states, which then promotes to substance abuse. So when clients' options for dealing with stress are limited by inflexible or all or nothing thinking, cognitive therapy can actually help them explore alternate behaviors and attitudes that do not include the use of substances. Furthermore, cognitive therapy can also assist a client in developing better perspectives on his or her drug usage past, as well as the significance of recent fall or relapse, so that it does not inevitably lead to future substance abuse. So that's it for the therapeutic process. Thank you.
All right, so thank you, Kir. Moving on to the similarities between behavioral and behavioral cognitive theory. Cognitivism and behaviorism are indeed very similar. Mechanism is a foundational principle in each of them. Regardless, both movements see human action, whether mental or otherwise, as being governed by physical rules. Finally, both movements have a dilemma in common. They employ subjective metaphors as the foundation for objective science. I'll pass it to the next presenter now. Thank you.
Thank you, Priscilla, for the explanation for similarities. I'll continue with the differences. So basically, behavior theory mainly focuses on humans' behavioral and how human acts, but it is opposite with cognitive theory, which describe about humans' mind and about the mental process of human. And then for the behavioral, it emphasizes observable behavior, while cognitive emphasizes on mental activities and process. So for the behaviorists have a straightforward view of learning. For behaviorists, forgetting is caused by a lack of response. So as a result, a teacher should go over material with students on a regular basis to keep the connection that they have made. And for the cognitive theory is regard memory as the encoding of information in the mind. According to this definition, forgetting is the inability to retrieve a memory. So first of all, this testing is in behavioral test proof effectiveness problems. So this theory is proven highly proven in the effectiveness for the problem. Besides, this theory can also finish in short period of time. because a client allowed to decide the verdict and goals during the therapy session. So when the session is mainly focused on the verdict and goals given by the client, so this theory can also be finished by the short period of time. And then this behavior theory also focus on specific problem, so it will reduce the ethical unaccountability. So when the theory is focused on the specific problems, why the problem occur and the reason why client come to us, so it will reduce the ethical unaccountability. So there will be no unethical ethical dilemma during the therapy. So besides this behavior theory also, clients will be informed what is going to happen. So they will know and will be educated about what is going to happen and how it will be done. And I will continue with the weakness for this theory. Many critics said that this theory is too unbiased because it does not consider the emotion of one's client, because as it mainly focus to solve the problem and to cure the symptoms of client. Because that is the main reason of this theory, it does not consider the emotion of one's client. And then it ignores why the change is needed and why the client's problem appear. This theory is mainly, like I said before, it is to cure and to solve the problem by given by the client. It ignores why the change of the problem, why the problem given by the client is needed to change, and why the client's problem appear at first. All of this does not conclude in this theory. That is also one of the weakness in this theory. And then it is also considered weak in expressing behavior and learning. I'll continue with the next slide. So I'll continue with the strength and weakness for the cognitive theory. So basically, one of the strength of this theory, it has many practical applications, and it can determine someone with autism or not. And it is mainly depends on experiment, because as its main it is a main research method. And for the weakness is this theory also consider weak because the theoretical nature of thoughts and hardness of the recognizing of the main problem. And then there's also a disagreement about the definition and application of this theory. And because Piaget is too focused on this cognitive theory, he overlooked the impact of social environment. I can say he ignores the impact of social environment can also influence someone's behavior and someone's how they think, how they act. And then continue with this one of the weakness of this theory. It is also cannot directly observe because it is too mainly focused on the cognitive approach. And lastly, this theory also is lacking as it only explains 5 of the main methods, which is attention, memory, perception, and language. I'll pass it to Monica for the conclusion.
Okay, thank you, Usna, for just now presenting her part. Okay, now I'm going to present my part, which is conclusion part. Before I start, let me introduce myself. I'm Monica, and I'm doing BPSY program at MSU. Okay, basically what we can conclude from the assignments is like behavior therapy and cognitive social theories explain why behavior are learned. They are made or they learned, how they taught, who learned them, and why they persist. Socio-cognitive theories are described like how my environments and the social interactions within it shape my smoking habit. So an operant condition strategy is which I lost my pair of my favorite shoes every time I smoke, or I reward myself with something I prefer above a cigarette every time I don't smoke will help me to quit smoking the chemicals. So finally, like we can feel that the social cognitive theories are encompassing my surroundings or the social incentive, like we got influenced by our personality more than basically cause and effect theory, behavior theories. So although that behaviorism that's more like how we respond to things thought association with it or not without flows. So because of the emphasis and experiment investigations of observable behavior, behaviorism is a scientifically sound that is a approach, while cognitive developments also have revealed that brains do not form in accordance that with the conscious blueprint or instincts like intellect, but rather as a result of variety of influencing circumstances. Like for example, if we want to our children to have a good command of language, okay, we may focus on few phenomena like awareness from that start. So the premise behind the behaviorisms is that's all behavior that we are learn, we are context with the environment. So according this learning theory, behavior are learned from their environments, and instincts is inherited variables and relieving little impact of behavior, while the cognitive theory stress and creative process and person process by highlighting the significances of cognitive mechanism as a foundations of for creative thoughts, and person by talking individual differences is such systems into the account. So that's all for me and for my groups as well. Thank you, madam.